Today, Amy Gordon and Felipe Christopher Blue will be discussing therapy regarding our perspective, therapeutic practices in the world that we live in that needs our services more than ever. Amy, how are you doing today?
I'm good. You're absolutely right. The world definitely needs therapy and therapeutic services more than ever. Hi, and welcome to Talk Therapy also. This is a special crossover episode with the More Than Therapy podcast. I'm here today with F. Christopher Blue, aka Mr. Blue, who's a therapist, podcaster, and author of Post-Pandemic Depression and Anxiety and Strategies to Effectively Manage It. Is that right?
Something like that. I don't even know. All I say is pandemic workbook.
Yes, totally. And we'll talk a little bit about the book maybe toward the end of this kind of co-interview.
Yeah.
Mr. Blue's podcast, More Than Therapy, is a wonderful variety podcast about a number of mental health topics. And most episodes are short and sweet, bite-sized. Definitely check it out after this.
There you go. Thank you. Amy, tell us about your podcast for my listening audience, because I really want them to have more exposure to mental health bites or blurbs or anecdotes or, interviews that can help them. Most of my listening audience are based on people from NAMI and people from therapeutic practices that I collaborate with, as they're very prominent on brochures that I give out, as well as I put it in the training tab in the ending where I give who was trained by. So I do a lot of trainings in the area for mental health professionals. And this would be a good way for them to get, additional, more support regarding, services. Some people don't actually reach out a lot of times. Sometimes the most they get is through a YouTube or a podcast or Instagram post or Facebook post.
Yeah, there are a lot of barriers to therapy. I agree. So, a lot of folks won't actually enter the therapy room, although hopefully maybe they will someday, but there is some stigma. But there are access issues too when it comes to insurance and financing. So I totally get it. My podcast is primarily psychoeducational, but I am a licensed therapist. So I bring that perspective into the podcast. I'd like to kind of discuss fringe topics that aren't often that a lot of therapists even didn't have exposure to maybe in grad school. So I like to just bring in some perspectives that maybe have not been considered by professionals. And at the same time, I like to make it accessible to just kind of regular people too. I want to make sure that we explain the languaging, that we explain the concepts so that anybody can listen and gain from the podcast. I'm a intersectional feminist adventure therapist. And so feminist psychotherapy and adventure therapy are always kind of woven into the episodes. And I would say that I like to focus on at least aspects of social justice in every episode. I think that's pretty important to consider, and it's so intertwined with mental health.
Indeed. My podcast, like you said before, a lot of short bites, blurbs, just some thoughts of the day. Every now and then we get a nice, beautiful interview with someone like you, Amy Gordon, in which we get to learn a different perspective and broader perspective. And sometimes we get to learn an experience that they normally wouldn't think about, Connecticut is a lot different from South Carolina, which is a lot different from Arizona. But interconnectedness, we all have an underlying story or something that we can connect to, that let people know that we're not alone in this world, and that I'm going through this and somebody else might be going through this, or somebody else might be able to help with an issue that I'm going through as well, just by their story, by their declaration. To normalize, to destigmatize, because a lot of times people feel like they're trapped in a bubble just based on the culture, just based on their experiences. And so they don't feel like they're even able to express themselves. But to hear people openly talk about their issues is an eye-opener for them for recovery and wellness.
Absolutely. Yeah. So you and I met online, just in a chat group. We were talking about mental health podcasts, and the topic came up of anxiety and depression. And it's on one level so basic. A lot of people struggle with both or one or the other, depression and anxiety. But I know that I've been so personally affected by depression and anxiety in my own life that as I was kind of thinking about doing a podcast on these topics, or this topic, I really became inspired to kind of talk about my own story in conjunction with some of the theories and methodologies and just what we know about depression and anxiety.
All right, let's do that.
Yeah. Awesome.
When
Would you like
I'll start if you don't, I mean, I give a bite and we can just go back and forth.
Sure. Yeah. Whatever you want to do. Like I've got questions that I wanted to ask you that I have some responses to as well. So I'm all about just doing this organically and having a chat. So just go for it.
Anxiety and depression was very prominent in my life prior to the pandemic. I was seeking therapy. I had a great therapist named Emily, and she gave me action plans, and she held me accountable for adhering to those action plans. But Emily had bigger dreams. So Emily transitioned to another job because she wanted to work with rape survivors. And I had to respect that. Of course I had to respect that. Do what you do, Emily. I'm proud of you. So I got transitioned to another therapist. This time I was paired with a male therapist. That didn't work as well because he wanted to work on mindfulness. My issues don't work well with breathing techniques and mindfulness per se. My issues are kind of prominent in what's going on around me at the time. And I disconnected because it just wasn't working for me. Then the pandemic hit and everybody was feeling anxiety and depression around. Some dealt with it better than others. I dealt with it by isolating to some degree, withdrawing to some degree, but then that allowed me to focus on, one, writing a book, two, developing online trainings and stuff to help through NAMI, to help other people through this storm. In all actuality, we worked through the storm together.
Yeah, I can't wait to check out your book either. I bet you got it. But I think that's really common for therapists too, to have their own kind of mental health struggle or inspiration, or maybe even this sense of like having been fortified through our own experiences, and we can apply those to helping others at some point in our lives. So I think that story is pretty common, and it totally echoes in my own life. Like I've had a similar experience. I really think of like anxiety and depression as being two sides of the same coin. And there are reasons for that, and we can get into that in a little bit. But when I was a child, I was extremely, extremely anxious all the time. I grew up in a pretty dysfunctional environment with folks with a lot of mental health issues. So I always felt like I had to walk on eggshells or something. And also, we can talk more about this later, but children who are in environments that are relatively or severely dysfunctional develop a nervous system that really keeps them in a survival state in that environment. So that absolutely happened for me. So as a child, I was really anxious, a lot of OCD behaviors, picking at my skin, and if I thought a curse word, I would excuse myself from class to go pray in the bathroom. I'd do 50 Hail Marys. I did a lot of really anxious ritual kind of stuff. And as I became a teenager, I became very, very depressed. And once again, there are reasons for that in the interrelationship between anxiety and depression, and that I will totally nerd out about when I get the opportunity. But I was suicidal. I was definitely using a lot of substances and stuff to self-medicate. And early in my 20s, I started going to therapy. And I really started doing some pretty intensive therapies like EMDR. And I did that stuff for years and did a lot of trauma recovery. I've been in therapy for over a decade. I have done tons of different types of therapy. And ultimately for me, what has been most helpful after exploring different therapeutic modalities has been medication. Quite frankly, I think that a lot of folks who have endured sort of lifelong trauma have developed a nervous system that doesn't snap back. It isn't quite as resilient as people who have isolated instances of trauma, because it's really been, for me, I'll be 36 this month, which I'll be releasing my version of this podcast in February. So I'll be 36 when y'all are listening to this. And so that's 36 years of basically developing a nervous system. Although I would say that, starting in my 20s, so for maybe a little over a decade, I've been doing work to heal that. But I do think of medication as being really necessary for helping me function like in a quote unquote normal way at this point. But I do really, really value therapy. I think that there's so many modalities that are so valuable. And I think that for some people, doing therapy in conjunction with medication is really the best option. So my story in a nutshell.
Well, and I agree, as far as medication, yeah, I agree with that whole concept. Medication didn't work for me at first because of the type of psychiatrist I was going to. I also my diagnoses are as follows: bipolar 2, PTSD, anxiety. So I guess there's a lot of intermix between the bipolar 2 and the PTSD. So, the doctors probably want to treat more of that. These are military doctors, military psychiatrists. And it was not really addressing the depression as much, you know what I'm saying? So a lot of times it will push me more into mania. So like you mentioned, substance use issues, a lot of maladaptive behaviors, a lot of things that hurt me and could have prevented me from being where I am today. But where there's a will, there's a way. That yesterday does not have to define today. And thank God for that. We move accordingly. Um, Today I'm on a regimen that seems to be working for me at times. But you're saying you can't depend on one or the other. It's a balancing act. Medication skills, and stay with that. And know your warning signs, know your triggers, and navigate your life accordingly. And make sure you have the right people around you. I think 2020, I think it was a blessing and a curse. And the blessing was it allowed me to remove things that did not serve me anymore, negative things that didn't serve me anymore, people that were taken from me and not giving back to me, not reciprocating. And I'm in a much better place today, that I'm not even as symptomatic as I was 12 months ago, 18 months ago at all, actually. In fact, today's a beautiful day. Really beautiful day.
Yeah. And will you tell folks what's up with the beard today? For my
Today, this day that we're recording is the inauguration of President Biden and Kamala Harris. And I've been waiting for this day for 4 years.
Once again, I can echo that.
So that's what it is. I'm not a nationalist. I'm not even typically your typical American. I come from Haiti. But today I'm proud.
Yeah. Well, yeah, I think it's really cool to explore diagnoses too. There are certain, and no diagnosis is like the be all end all, like perfect definition of what somebody's experiencing. It's just a cluster of symptoms that kind of have the like belong together in ways that a lot of people have similar clusters of symptoms. But yeah, I've actually been misdiagnosed as being bipolar 2, but really it's the way that my anxiety and depression vacillate. I don't really actually get manic. I just, I have more intense anxiety and insomnia at times. But yeah, I've also been on a gamut of medications working with that. But my primary diagnoses currently are generalized anxiety disorder, dysthymic disorder, and PTSD also.
I'm very familiar with dysthymic disorder. That's my ex-wife's diagnosis.
Oh, yeah. When therapists get together, we nerd out like this.
Right. She avoided the therapy trap because military. She didn't want it on her record. She felt it would impact her ability to move forward in her career. So she just suffered silently.
Yeah. That's so unfortunate. And I really hope that, shows like ours and all sorts of just like, mental health for the masses, whatever that looks like, whether it's, it's a therapist on a reality TV show or whatever it is, whatever we can all do to help destigmatize mental health care is really important work.
Indeed.
Yeah. So if you don't mind me asking you a few questions, Mr. Blue, I've got a handful for you.
Okay.
Okay, well, the first question is just, what are the what are theories or, I guess a theory, or is there any kind of theory or theories? Oh my gosh, let me repeat that. What theory or theories about anxiety and depression do you most subscribe to? Like which ones make the most sense to you, or how do you think of anxiety and depression?
Like you said before, I find that anxiety and depression are two sides of the same coin. A lot of times when people get anxious, they become depressed because of it, or attributes of it cause them to become depressed, and vice versa. I'm more of a solution focused therapist. So we look at the solutions, we look at strategies, we develop action plans to alleviate the stressor for you to move forward. And I find that to be very effective. Some therapists I know they might do look at the past, psychoanalysts and things like that. Um, I find that might be useful at sometimes, but I don't know how long somebody might stay in therapy. So, I'm not saying it's a quick fix, but if this is your primary issue and this is what's bothering you and this is what's going on, let's focus on that. And if you want to work on the other stuff that drove it, that's fine. But I find that if you're able to alleviate the stressor, talk about the stressor, develop a plan around it, and it no longer is no longer an issue for you. Do you really need to figure out that you were at 5 years old, this happened, so therefore I'm not. This is why I act this way. You're not going to act that way no more if you're utilizing the strategies that you develop regarding your issues in a lot of cases. Now, of course, extreme trauma and things like that, you probably have to do a lot more, of course, establishing of the coping skills and then, figuring out the triggers that happen then, which is bothering you now. So then you might have to make more of a connection. But that's a very delicate tightrope. I also find that even concepts of dialectical behavioral therapy is beneficial. I never tell them there's dialectical behavioral therapy because for some reason people really, really hate that term.
I mean, first of all, it sounds boring, but second of all, there is kind of this implication that somebody has a personality disorder if they're engaging in DBT, which is not true, not necessarily true.
But often, because I have a high, my caseload has a significant number of people with that were previously or currently diagnosed with borderline personality disorder. They feel like my particular skill traits are able to address those issues. Oftentimes, I would say 60% of the times, that's not even their diagnosis. You know what I'm saying? After working with them, figuring out what's really going on, is it was just the way maybe when they presented in the assessment based on their history that it alluded to that. But no, I could always, much of the time, knock it back down to bipolar disorder or in some cases, major depression disorder.
Yeah, I mean, in the way that I learned about personality disorders is very much like trauma or very much like depression and anxiety. It's really, the root is really trauma. So in effect, you're kind of doing the same thing. You're working with that trauma and you're learning new responses to that. So yeah, that makes sense. I love solution focused. I love that you're doing that work. That's something I was really interested in. And, there's just not enough time to learn everything, but I think we both work with really integrated therapeutic modalities. But that is when, you're like, okay, what's the most imminent need? Let's address that. And you just focus on the most imminent thing. And I don't do a lot of that, but I really appreciate it. For me, I'm really into polyvagal theory. I really adore really the theory's explanation for why and how depression and anxiety manifest. And in short, the theory states that anxiety and depression are natural survival strategies in essence, that we are, as human beings, we're animals and we do have these survival responses. So anxiety, or like in polyvagal theory, we refer to it as hyperarousal. Sometimes there are other states of hyperarousal, like anger, for instance. But anxiety or hyperarousal keeps us alert so that we can respond through fight or flight instincts to any impending danger. And depression or hypoarousal results if we have, and often unconsciously, determine that fighting or fleeing would be futile. Like, if a child is powerless in a situation with an adult perpetrator, we might freeze in a situation like that, or a child might go into freeze, which results in not only like a physical numbing of pain, but sometimes dissociation because the trauma is just too much to comprehend, and strategic survival reasons that exist in the animal world, like playing possum. I don't know if you've heard of that term before, but possums actually do this. They go into this state where their heart rate slows down, their temperature drops. It's like almost this like in-between state where they're just really unconscious. But anyway, playing possum, it turns off predators. So if a predator believes their prey is already dead, it's less likely to try to hunt it. So the natural world is wise, and human animals are absolutely a part of nature. So when we're recovering from anxiety and depression, we've got to thank that anxiety and depression, because it's wise and it's kept us alive.
Indeed, indeed. Great point about the possum. I just saw one the other day.
Yeah, there's some really good footage of animals coming out of kind of shut down states, and how they have to actually move the energy out of their bodies through shaking and stuff. And some of the recovery methods for anxiety and depression or trauma are really the same. We do a lot of somatic work.
Right, that's true. That's true. They say the body holds the memory of the trauma.
It absolutely does. Yeah. And it's literally like an energy that's stuck in the body that needs to be moved, or, it doesn't need to be moved, but if you want to feel better, you're going to want to do some work to help move that energy out. And you usually have to go through the pain, though. You have to go through the experience. Yeah. And actually, when it comes to depression, depression is actually just kind of like a layer deeper in your brain. So, basically there's the lizard brain, the mammal brain, and then the human brain, or you can say the cerebellum, the limbic system, and the prefrontal cortex. But they've all evolutionarily developed in that sort of hierarchy. And so I have a cat howling. And so depression really occurs in this the deepest lizard brain, the cerebellum, and anxiety is more in the limbic system, which is more mammalian. So the work is really, when we go into shutdown and we're stuck in that lizard brain, we actually have to go through anxiety. We have to go through hyperactivation in order to get back to regulation. It's really interesting stuff, the neuroscience behind it all.
Sounds very interesting. I never heard it explained that way before. I'm definitely going to look into it when after this interview or discussion.
Yeah, it's juicy stuff. So Stephen Porges is the theorist on polyvagal theory, and so I'm trying to think of the name of the author of the Waking the Tiger, and oh my gosh, I can't believe it's fleeing my brain right now, because I just love his work. But anyway, there's a lot of neurobiology research, a lot of information, books, and all of that out there. So pick them up. They're not only for therapists, they're for regular folk to read and learn also. So we did talk a little bit about modalities, Mr. Blue. Is there anything else you want to say about kind of the way that you work with depression and anxiety with clients?
Oh, I just meet them where they're at. Like I said, solution focused. I also use a tool that I learned about, and I use it very readily. It's called the Wellness Recovery Action Plan. Mm-hmm. And that's actually one of the talking points of every session. I mean, how are you relating to, how are you utilizing your Wellness Recovery Action Plan? If they call in a crisis, that's one of the first things I might bring up, besides, assessing for suicidality or something like that, is their utilization of the Wellness Recovery Action Plan. And it's organic, so it grows with them as they learn new skill sets. As Billy might not be, hip to journaling, but maybe in a session we journaled or had a journal entry in which he spoke about or wrote about, and so now that's one of his go-tos. So he found it beneficial, but maybe he got away from it. So, and that's talking to him about his wellness tools, his general maintenance tools, and things like that can assist him with reducing anxiety or depression or crisis state. Helping them understand their warning signs before they even get to the point where they're hyper vigilant regarding crises or depression or any of those things. Cutting it off before it becomes too much of an issue. Getting it, addressing it through a strategy before it becomes too big of an issue to deal with effectively. Catch it early, deal with it effectively.
I think a lot of therapists use something like that, or a safety plan, and it's very static. It's very oh, we developed this, I put it in your file, I gave you a copy, who God only knows what you did with it. But I love that you keep it alive as an organic, living, dynamic document that you keep working on and referring to. That's great.
And it's really more of a help for me than for them probably, because, it's like, oh my gosh, what's going on? so let's you do like, oh, okay, we got that. I keep a copy on my phone. So, and my phone syncs with my iPad and my MacBook. So I always have it on me. I always have access to it. So that's very beneficial.
Yeah, that's great. Anxiety and depression aren't really specific, I guess, targets for some of the therapy that I do, but it's always kind of woven in, of course. And like I said, I see depression and anxiety as being different sides of the same coin, basically being the nervous system's attempt to regulate through pendulation between hyper and hypo aroused states. So I think it's important to honor the nervous system's impulses and listen to the wisdom of the body. And we call this interoception in the field. So that's looking within. So I like to assist clients in developing interoception. I think it's a really great way to help them begin to recognize what's going on inside of them. And that awareness of what's going on really opens up a lot of possibilities. So you can do powerful work through a lot of the modalities that both you and I use. But some of the ones that I use more frequently are somatic, gestalt, and adventure therapy. So doing kind of novel things to gain insight into like our responses. And I think an important consideration is that sometimes we're working with a client to alleviate their depression. And like I mentioned before, like getting out of depression often requires at least a momentary entry into anxiety. So I think it's important to mention that as a part of informed consent, that like in working on depression, you might actually experience a little more anxiety as a result. And it rarely occurs the other way around because of just the way that neurology works. But yeah, anxiety is, basically the activation of the body's instincts to fight or flee a situation for survival. Depression is the next step that occurs like in deeper levels of our neurology, to go into shutdown. So it's a more desperate attempt to survive a situation through freezing. Like I said before, it's when we realize that fighting or fleeing would be futile, which is almost always unconscious. So simply put, you have to go through anxiety to get to the depression. And the other way around. Depression exists on a deeper level. But yeah, that's really a lot of the work. And yeah, I don't know if you have some thoughts, but I have another question for you, Mr. Blue.
Yes.
Okay. What are some considerations you make when you're working with anxious or depressed clients? Like, what are things you might do differently, or things that you pay attention to, or I don't know, anything that comes to mind?
I pay attention to what might be trigger them, their diet, their environment, their interactions with others, any upcoming events that might be impacting them. I also look at myself. I mean, am I a trigger for anxiety? Do we need to go to a different place to do the session? Do we need to conduct the session differently? Making sure, the right voice, utilizing the right voice, or, because you don't know, sometimes just, if they come into an office, a lot of my sessions might be, well, now virtual, but, in their home, some people do come to my office, and maybe that environment is triggering for them anxiety because of the power differential. As a therapist and a client in a home looks and feels a lot differently in an office setting. Um, and though it's not as impactful in a Zoom session, which has its own issues. Um, and that, just figuring out, letting them being open enough to understand, and not always having the answer as a therapist. You know what I'm saying? They have the answer. Let them open up to figure out, what's going on with them themselves, and through that declaration, maybe we can find out how to effectively deal with their anxiety as well as depression. But like I said, look at, some of the common things that might be feeding it. An intake of caffeine could induce a heavier load of anxiety. Cake and ice cream. Yum, yum. The diet could be a high contributor.
Yeah, or being on
Use of mind-altering substances. Marijuana, alcohol, cocaine, um, If they're on diet meds, that could definitely, punctuate it to some degree.
Yeah, ADHD meds.
Mm-hmm. Right. I have a lot of clients that, they purposely seek those out for some reason. I can't focus. Are you working? No, then what you need to focus for? No, just
I love that you visit clients at their home and you provide mobile therapy. I think that's really rare. But you're right. And it's actually one of the precepts of feminist psychotherapy. Oh my God. Your kiddo's back there with a flag beard. So cute. uh yeah. Yeah, not a lot of places do that, but like I said, it's one of the precepts of feminist psychotherapy that you try to disempower the therapist to a large extent because you want to empower the client. They are the expert in their own experience, but they're going to be a little more guarded and defensive if you're not trying to level the playing field when it comes to power dynamics. So I just think you're brilliant. I'm really glad.
Oh, it's not something I came up with. When I was in my internship, I used to go to Webster University, and Dr. Deanne Morrison, she worked in a rural community, and she knew, or at least she thought, and she was right, I'm sure, that these rural clients who lived far, far, far away from any office setting needed people to go to them to get it done. And it just makes more sense to me.
Yeah.
And it gives the power back to the client, you know what I'm saying? And I can, as a therapist, I can see more of what's going on in your home versus them telling me.
Yeah. Oh yeah. It's great for assessment to like see, someone's home. And especially if you can watch them interact with family members or roommates or whatever. Yeah. It's very like telling, very informative. Mm-hmm. Yeah, I think I love the considerations that you make. I make some of those as well. One thing that I also really like to do in terms of like empowerment is really provide knowledge. Knowledge is power. So, it's our job to teach clients what's going on for them. How maybe for me, that includes like how the nervous system works, but psychoeducation is what we call that. And it's always woven into the work that I do with my clients.
Indeed, indeed. I feel like the more you know about your issue, the better you're effectively able to deal with it. And, we don't learn this in school. We don't learn this in our family systems a lot of times. So we have to learn it in therapy. I also find that people who get therapy are better equipped to deal with crises or issues than those that never got it. In my experience, I noticed that a lot of the clinicians I work with did not fare well in 2020, while the clients did very well because they already had a skill base able to effectively deal with these types of issues, not necessarily a pandemic, but being triggered, having anxiety, having depression, versus the therapists who are supposed to be the experts. Mm-hmm. We're like, oh my gosh. And just really, I've seen some burnout. I've seen a lot of issues with that population of those that didn't necessarily get therapy themselves. I prescribe to therapists need therapy, and that those that don't necessarily get it are really doing themselves and their population that they serve a disservice.
Yeah, I wholeheartedly agree. And like I mentioned earlier, a lot of therapists are drawn to the field because they've experienced basically psychological distress and are trying to make sense of it. A lot of us work through that, during our scholastic endeavors. Some people don't, but in my experience, therapists tend to be a bunch of like navel gazers, like really kind of obsessed with their own emotions and like needing things to be a certain way. So I can see that. Yeah, I know some really like finicky, just very like self-involved therapists. So I've seen a lot struggle during this time of crisis as well.
Unfortunately.
Yeah. And I imagine you do this as well, but another thing that I like to do with especially anxious or depressed clients and those who vacillate between the two frequently, I really like to be super vigilant around monitoring their states of like nervous system hyper or hypoarousal, sharing with them what I'm witnessing. When I said this, your body slumped. It seemed like you were going into a shutdown state, and just reflecting that, because a lot of people don't have people who are reflecting these things to them. So it helps them learn what they're doing and why they're doing it. So, like I mentioned interoception earlier, but doing that can help clients develop that interoception. So, it also helps make sure that we're not pushing somebody past their healthy window of tolerance. So if you're seeing a client who's they start kicking their leg and picking at their skin or pinching themselves or going into this shutdown state, that's a cue to the therapist to kind of to help regulate, to get back on track with a regulated state before moving forward. Because if we don't do that, we're really just reinforcing, traumatic neural pathways, and we could even be re-traumatizing our clients. So, and at the very least, we're just not helping, because you're not learning in that state. If you're hyper or hypo aroused, your prefrontal cortex is offline and you're not learning. So it's important to monitor and not push somebody too hard.
Indeed. And thank you for bringing that perspective to the forefront. That's definitely something I want to marinate on and think about, especially regarding interoception. I mean, that's a concept I'm not familiar with, but definitely want to read up more about.
Yeah. Well, I would love to know about your book. I want to know more about your book. Like, what's the content like? What inspired it? And of course, where can we buy it?
My book, I was doing a conference for NAMI Durham, and they wanted to talk about the pandemic and how it was impacting people, and they wanted to develop support groups out of it. So I had a conference discussion forum thing one weekend, and so I had to do so many PowerPoints and integrate video and media and things like that. And there was a lot of questions that came up, a lot of concerns that came up during this thing. It seemed my PowerPoint really wasn't that important. They wanted to discuss what they wanted to discuss and ask the questions they wanted to ask. And that's fine. What I'm saying? I use the PowerPoint for something else down the future. So when these questions came up, and I had some of the answers, but some of the answers I didn't have. And so I was just jotting down some things that I told them I would follow up with them on, and I email it to them. So after writing, it came up to be about 100 pages of dialogue or literature. I said, well, this is easy. A little baby mini book of some sort. Let me send this ebook to all these people, and let me put it on Amazon to see who else could utilize it could help, especially those with the Amazon Prime option. They can read it for free, right? So that's what I did, and it was called, Post-Pandemic Depression and Anxiety and Strategies to Deal with It Effectively. So it's just basically assessing, what's causing you to have depression or anxiety, self-assessment, and then different strategies you can deal with it effectively. Taking care of yourself, eating correctly, what I'm saying, addressing your spirituality, resting appropriately, making sure you have the right supports around you. Quick read, what I'm saying. Some people, they say they can read it when they're pottying. I say you sitting on the potty way too long. And a lot of therapists I know, they bought it and they utilize techniques and strategies in it, and they say that they find it very beneficial. I thought somewhat out the box regarding some strategies, some things I might have learned while I was in the military, or some things I might have learned just because. And I have this thing for acronyms, so I threw an acronym in there and I made it work.
Wait, I got to pause you. I want to know more about strategies that you learned in the military that aren't really traditional therapy.
Oh, no, I'm not sure. They might be more traditional, but I learned them in the military, so that's what I associate with them. HALT is an acronym. I'm sure you're familiar with that. Don't allow yourself to get too hungry, too angry, too lonely, too tired. Nurse, address your nourishment.
I haven't heard nurse.
Yeah, I don't remember the words, but it's in my book. Spirituality, eating appropriately.
By the book.
Rehabilitation, resting appropriately. I can't remember what the U is for, but yeah. Just things like that. A lot of people don't realize that a lot of the strategies utilized in the military, especially coming out of Vietnam, transitioned themselves into modern day therapy to some degree. I want to say they were experimented on them, or they saw a great need there in that population, and then they saw that it worked for the regular population. One of the modules that we use here in North Carolina is called the Illness Management Recovery modules, and it's by SAMHSA. Well, SAMHSA has it now, and it came out of a military doctor, military way of doing things regarding help, and they say that it's 90% effective. I found that it's 60% effective. I don't know why did they get these inflated numbers from, but multisystemic therapy. Some people say they can find the source of it based on some military focus on how to do things or how they address people's mental health and wellness. I wasn't able to find that connection, but some people say that. Some of the veteran physicians and therapists I work with, and with that, you're basically finding the sources that impact that particular issue and dealing with those sources effectively. Utilizing what they call like a fit circle. So maybe in the middle of your fit circle, you talk about your you're feeling sad or depressed, and then from that circle comes the lines. What's driving your depression? So it might be your financial situation, it might be your housing situation, it might be your relationship with your wife, it might be your kids aren't doing what you're doing. So then developing strategies, action plans, and interventions to deal with each of those issues in order to alleviate your feelings of depression.
I guess it does make sense. Although you said you're not you're not aware of how that connection was made, but like it does make sense that like a multi-system entity like the military would really contribute to the development of that modality. That sounds really cool. Really like diverse content. Like there's a lot to read and a lot of different considerations to make.
Yes, 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 indeed, indeed, and it's just a taste for what's to come. My next book. Mm.
Yeah. Are you
Halt. Don't allow yourself to get too hungry, angry, lonely, or tired. So we deal with strategies to deal with each of those issues in order to be a better you and navigate this world accordingly. And then one day I'll release my book, From Crip to Counselor. But I was advised to release it posthumously because of some of the content.
Wow. Well, I hope you live till you're like 150, but I also want to read that book. So
Oh, but thank you, thank you, thank you. I might release it in such a way that it's not me, but it's based on a true story that might be able to, so I can release it a lot earlier. But it's a tale regarding just the things I went through in order to get to where I'm at today. I think I know for a fact that if I didn't go through some of those things, I wouldn't be where I'm at today, at least yet by any means. Because honestly, I was supposed to be a rapper. I was a rapper. No,
I've heard you rap on your podcast.
right. Well, thank you. Um, but nah, it could have went a lot of different ways. I think what impacted me is I wanted to be what I wanted to receive or what I should have received, and that's where I am today, doing the work in such a way that if I was on the opposite side, that's what I would want to receive in order to be better, in order to get through what I'm getting through, and that's what I commit myself to doing. This is
Yeah,
regarding
I
my youth, my mental health, in the military, even after the fact, after my brother was killed, just things that impacted me where I didn't really get what I needed. And it might have been just based on who I went to or, the reasons why I went through, or even my background that contributed to that therapeutic approach being impacted on me. Um, I think mental health has changed a lot since then. It had to, because we're talking about like 95, 96, in which a lot of that stuff happened. And I see a lot of good clinicians coming to the field that are doing a great job.
Mhm.
I find that the old fogey ones, though, probably need to go ahead and step aside.
Hmm. Yeah, there's some good seasoned vets, but our knowledge base has changed and people have changed. Culture has changed. Like so much has changed that it is important to stay current.
And I think, yeah, we have to get CEUs, to stay, to keep our licensures. I just think that, even us, even as, the younger clinicians, just get ones that are appropriate to address some of the issues that we didn't cover in school, that weren't covered in school, that might be impacting the population right now. Like we didn't know nothing about no millennials when I was in school or their issues, which seemed like what y'all dealing with, y'all suffering on that.
Yeah, cyberbullying. There's a lot of movement in terms of like gender identity.
Right,
There's things
right,
that like weren't really happening when
right. I remember one person who identified, as a transgender in school. That was just one, and he was he embraced his stuff. So people that's going through, these transitions in life and not feeling like themselves in their bodies wasn't
Mhm.
something that was covered by at any degree in my master's program. I have all
My
my books and I look through them all the time, and I was like, well, it's not there, but I have been able to get that training through CEUs, through curriculum-based trainings and stuff like that after the fact, years after the fact, which helped me effectively address the issues in practice. But some things are outside of my scope, so I will refer appropriately to people that have a better understanding of that issue, that went to a school that readily addressed that issue in therapy.
Your kiddo's back there with a beard too. Again, so cute.
And I'm back.
Do you have any final thoughts or anything that's just like randomly popping in your mind that you want to share?
Yes, yes. We had a rough couple of years. The last couple of weeks were really jarring to a lot of people. I think that change is hard, and I think it's going to be this year is going to be very interesting. I want people to address their wellness and recovery appropriately and do what they need to do in order to do so. As it's not a on-off switch regarding change. That the things that we've seen, the things that we experienced, aren't going to go away overnight. Not in a year, not in 2 years, in my opinion. We've seen a lot of pain, a lot of hate, a lot of fear that might increase in the next couple of weeks or months. But to deal with it effectively, what I'm saying, pray about it, write about it, talk to others about it, whether it's a therapist, family member, or other natural support. And we'll get through this, much like we got through anything else, I suppose. Um, Utilize podcasts, utilize journaling, utilize books that are on Amazon or on Barnes and Nobles. There's a lot of great literature out there that can help people get through their issues, or effectively to think differently, or develop strategies for yourself. Like we said before, or like you said, sometimes, people can't get it because of various means, whether it's financial, whether it's culture impact. But you can get it through other means to some degree. You know what I'm saying? If you feel you can't afford it, there are ways you can afford it. BetterHelp.com. Some systems, like where I live at, have what they call IPRS funding, which means people can get mental health and psychiatry help at no cost to them. It's state funded in that way. Um, and then, support groups like NAMI. Most states have NAMI. I think all 50 states have NAMI, and you can get support through support groups or other resources via that program. No matter where you're at in the United States, you can utilize services like United Way. You can simply dial that resource to get the information regarding any subject regarding your wellness and recovery, as well as other case management needs, simply by dialing 211 in your telephone. And that's any landline and now cell phones. If you're having a crisis, text 721-721, home or help. And then you can use text crisis lines. And then, of course, there's the 1-800-suicide crisis line as well. But some people prefer to text to get through their issues.
Mm-hmm.
Number of resources out there. Google is an excellent way to access those resources. And there's really no excuse not to get the help you need in 2021.
I love that. Yeah, I agree. I mean, just fill your cup however you can. If that's reading self-help books, if that's just going into like a rabbit hole on the internet, the chat groups, the blogs, there's so much out there, and it doesn't have to be therapy. Therapy can be incredibly powerful and helpful in a lot of ways, but get the help however you can. You don't have to talk to a person one-on-one to do that necessarily. Some people do. Yeah. Thank you.
How can people, find out more about your movement?
Really, I just have the podcast, and my Instagram is probably the best way to get a hold of me or to learn more about the podcast. So my Instagram is Amy Gordon 1985, Amy Gordon 1985. You're welcome to find me on there. I post a lot of like adventure therapy pics, so it can be pretty fun if you're interested in being outdoorsy and how therapy works with the outdoors and the way to integrate like novel experiences with therapy. That's something I do post a lot about. So I'd love to see you there. That's about it for me. And how about you? How can we find out more about you and what you're up to, your books, your podcasts, etc.?
www.morethan.therapy.org. That's www.morethan.therapy.org. February 6th, I'll be doing, I don't know if this will be released before or after that, a racial trauma retreat in which we'll talk about some of the issues regarding the trauma of racial disparities here in America. And that's a whole forum, discussion forum lasting about 3 hours. And that's via NAMI, as I think we need to talk about these issues, as a lot of these issues truly impact the population in ways that are just being seen in therapy.
Oh, it's so important. Yeah, check it out. Thanks everyone for listening.
Thank you.
Do you mind if I'm going to change my view to just you and take a few like solo shots?
Oh, that's fine.
Okay. Yeah, you look so fly. I love that. What are you using for your filter? Is that actually on Zoom or is it?
Ever heard of Snapchat?
Okay.
But anyways, you can download a free program called SnapCam. It's for your computer, MacBook, or regular PC, and it just gives you all kind of filters. I'll show you a few things.
It's so fun. Do you want to give me a smile? I can say something about like poop or pooping while reading your book. That's cute. That's good. I'm not much of a comedian. I try. I'm funny. I love to laugh, but I can't tell a joke to save my life. Oh my gosh, you're beardless.
I used to do a podcast with this guy. He was a punk rocker, so we had a lot of dark ones.
Oh my God, creepy. These are so much fun. Holy shit. I'm having way too much fun.
It's not a joke. Like Heath Ledger on, and I like this thing called the I forgot the name of the program. It comes on HBO. Rorschach.
Yo. Oh my God, yeah, it's like a Rorschach ink blot.
Right.
I see a bat.
Huh?
I see a bat.
Oh, okay.
Yeah, which is, I think that happened on Batman Returns. Thank you so much. I probably should hop off here in a sec because I've got a 1:30. I kind of need to do some prep work for it's a court case, so get all like court ready.
To meet you, thank you for the podcast crossover. I think you did a wonderful job.
Totally, yeah. Thank you. And I'm sure your recording sounds so much better than mine. So once you get that rendered, if you wouldn't mind sending it to me, I would really appreciate that.
The video.
You could send the video. I'll convert it to an MP3. I haven't been doing anything with video yet.
Okay, I'll send you audio.
Okay. Thank you so much. Happy Wednesday. Happy Inauguration Day.